All right, well, I'm going to go ahead and get this kicked off. My name is Chris Gavon. I'm one of the co-founders of Levita Compounding Pharmacy here in San Diego. I'm also a compounding pharmacist, so that's where I get involved. I'm really excited to be doing this presentation today with Dr. Tarabrina, who we've worked for in the past. And when she's up, she can tell you a little bit about her practice and her beliefs. I know we were very aligned in that we believe there's root cause. Don't just chase symptoms, but the body has this innate ability to heal itself in the right hands. So we're excited to have her here today. Stick around to the very end because there's going to be some giveaways. They're going to spin the dial like we're in Vegas. So today could be your lucky day. We're going to give away a little Levita swag. So not that we all don't have a lot of these, but Levita, a nice cloth embroidered face mask, and then a little visor. It's golf season. It's springtime, time to get out there. So, and I know that Dr. Tarabrina is also giving away 2 30-minute consultations to sit there and pick her brain. So that's a pretty cool thing. Ask your questions along the way. If you look down at the bottom, there's a chat icon. If you move your mouse, just type your question in. We're going to read them as we go and try to answer your questions as we go. We think if you do it that way, everything gets answered and instead of forgotten and waiting until the very end. So let's get going. Let's launch in. I first want to thank our sponsors. We're on the sponsor screen here. Of course, the Good Doctors Practice, Del Mar Integrative Medicine and Medical Spa, and Bella Serena Beauty and Wellness Spa, and Go-To Pics, your photographer for life. So thank you for your sponsorship. And let's get rolling, Doc, if you want to move to the next slide. Okay, here we are. You see us up on the screen, Dr. Anna Tarabrina, who's a naturopathic doctor, and she can tell you a little bit about what that means. I've been a compounding pharmacist for 20 some years now. So I've been doing women's health and healthy aging and men's health too. We don't forget about the guys for a long time. So this is your time. Ask your questions. We're here to give you really good information. Everything we're going to say today is just not our opinion. It's also based in science. So today's your day to get some things answered. Go ahead, Doc.
Okay, my name is Anna Tarabrina. I am a naturopathic doctor. I practice at Del Mar Integrative Medicine. It's a primary care practice. We deal with all kinds of health conditions, but by the nature of just being naturopathic doctor, I deal with a lot of hormonal issues because a lot of those issues are not very addressed in a primary care setting if it's not a naturopathic doctor, because a lot of issues that come up in these women are, we're going to discuss the issues, but a lot of them are just cannot be addressed without bioidentical hormones a lot of times. And plus, the beauty about what I do also that I'm not just addressing one system out of all the systems in the body that we have. We kind of, when you come to me, we discuss everything that will going on with you and trying to make a kind of comprehensive plan for you that will become not only gonna resolve your symptoms, but also gonna bring you overall wellness and health. So that's what I do. And I take pretty much all the PPO plans and all kind of almost all the health insurances are available commercially. So, which is a great thing and kind of a rare thing for a naturopathic doctor. So you're welcome to consult with me. So, but today we're going to talk about the bioidentical hormones and what it is, what's the difference between bioidentical and non-bioidentical hormones, and how it can help you to resolve some of the symptoms of a menopause. So the idea is to, to make you feel like you are again, because a lot of women that come to me, they have certain symptoms. They just come up, like everything is going well and they have no changes in life, but they just start all of a sudden have those symptoms. A lot of people, women Most commonly, it's a hot flashes. It's just like this feeling of heat that comes on all of a sudden. It just stays the view. It could stay for a couple of minutes. It could stay for longer. A lot of women suffer from sleep once they start having this issue, because it's just they have constant interruption of sleep. They wake up sweaty. They have to change the clothes. It's very annoying. It's very life-changing to have this symptom. Another symptom that I hear a lot from women, it's emotional changes. They become very emotional. They just all of a sudden, like they love their kids, they love their husband, but they're all of a sudden they become, very abrupt of them, or very just not themselves. So that's another very common symptom. Another symptom is changes in sleep. Changes in sleep that also can make them feel very tired the next day. So that's also could be very life-changing and disruptive. Some women have digestive issues, feel bloated, or just all of a sudden again feel like they are just gaining weight by the bloating that they feel.
I hear that all the time. That often that's what my patients will say to me that gets them to go in to see docs like you, is the vanity part of it, which whatever it takes.
Yes.
All of a sudden they got that muffin top thing going on, right?
Weight gain, it's a huge problem. And like another problem is the changes in libido. They just feel like, they just don't feel like doing it again, or like a vaginal dryness. Another common symptom, again, it starts to be painful to have sex, and it could be a problem as well. So this is kind of the most common symptoms that I hear from women, but they could be more, like, some people feel like itching in the skin, dryness of skin, changes in their brain function. I see a lot of women who have like high like executive positions where they have to like think and direct and be very focused, and all of a sudden they cannot do it anymore, and that could be because of their changes in hormones. So that's kind of the main symptoms the women come to me, and we all might experience as a part of going through the menopause. Okay. So, I mean, the great thing about, about that, that it could be changed, and it's we can make you feel better, basically. You just need to come to the right person to address those things. And so let's talk about what is this perimenopause versus menopause, because a lot of times it starts early for some women. It starts in their late 30s. It's or 40s, and they still have their normal periods. And so a lot of times it's confusing. I still have my normal periods, like nothing kind of seems to change, but it's actually like you can still go through this perimenopausal changes, although you still have this like a kind of a semi-normal periods. Because it starts 10-15 years before we hit this menopause. So the menopause, it's the term that is used in women after they haven't had their period for 12 months. So before that, you in the perimenopause, basically. And so, but for a lot of women, they start having those changes, like I said, before they hit this kind of milestone of not having their periods for the 12 months. And also, I need to mention that a lot of times you also can start having changes in your period, like periods can become heavier. You can start having like a more PMS symptoms. You can start the regularity changes. So that's all kind of signs of changing hormones. And when this kind of women come to me, we definitely do some blood work and see what's going on, and actually start there and see if it's actually because of their menopausal changes, or
And if I can add, Doc, I have patients that come to me and say, there are those lucky women that just don't have any symptoms, and they're like, oh, I sleep like a log, and I don't have hot flashes and night sweats. And they say, do I still need to look at my hormones? And, my answer is always, yes, you should look, because you have estrogen receptors all over your brain, all over your heart, all over your bones. And you may have no obvious signs that you're things are in flux, that perimenopausal time. But until you lean over maybe one day making the bed and you fracture a little vertebrae in your back or something, and that can happen. I see it happen all the time. People didn't know that their bones were in decline, or that their heart could be in decline. You wouldn't have symptoms until something more major happened.
It's yes, and I agree with that, Chris, because it comes into the prevention, because we need hormones for our heart to function normally, for our bones to preserve its density, and all of this also comes into play because a lot of women, they don't have any of those symptoms, which is great. Like, but the concern is still there to preserving this cardiovascular health, to preserving this bone health as well, because we're going to talk later about the roles of this, like estrogen and progesterone and testosterone in all of these systems of the body. So let's move on and talk about that. Before we start there, let's talk about the difference between bioidentical hormones and non-bioidentical hormones, because it's a little confusing. So basically, bioidentical hormones are the same chemical structure that are hormones that found in our body. And the beauty in that is that our body takes it as part of normal physiology. Basically, we're not changing anything. We're not changing chemical structure of the hormone that we use. And so because of that, it does not act any differently than our normal hormones that we produce throughout our lives would do. And that's a big thing, because a lot of research that has been done on hormones, on like estrogen and progesterone, it's been done on non-bioidentical hormones. And we need to remember that when we looked at the research, because non-bioidentical hormones, it's a hormones that look close enough to bioidentical hormones, but they have a little bit of chemical change in them. So they still can activate the receptors, estrogen or progesterone, but they are not activating them at the same at the same rate as the normal hormone, like bioidentical hormones would do. And because of that, non-bioidentical hormones can have such a bad side effects. They increase cardiovascular risk, they increase strokes and heart attacks, they increase breast cancer. And so that's why a lot of women right now are afraid of supplementing hormones, because of those research and those studies that has been done. But most of those studies has been done on non-bioidentical hormones that are not chemically the same as the hormones that we produce.
Right. Very good point, Doc. Not all hormones are created equal. And I think women hear estrogen and they just think estrogen bad. And really, as we just said, you have estrogen receptors all over your whole body, and we're living longer. We were never supposed to live this long, with the advent of modern medicine and sanitation. We're living well past what our endocrine system thought we should, because it kind of starts petering out in the 40s, and you have less and less hormone on board, but we still need the hormone now because we're living longer. So you just have to replace safely.
Exactly.
Yeah.
Exactly. And okay, let's move on and talk about estrogens. So estrogens, like Chris just mentioned, participates in more than 400 different body functions. It regulates our body temperature. That's why once we start having decrease in the estrogen, we start having these hot flashes. It's like mismanagement of our temperature regulation that happens. It's important for our blood sugar regulation, for insulin sensitivity, for our sleep, for our cardiovascular function. That's a huge thing. And actually, research has been shown that women who supplement the bioidentical hormones, they have it's a cardiovascular it has cardiovascular protective effect. So they have less chances of getting the heart attack and strokes. So that's also important, even if you don't have any other symptoms of the menopause. It maintains your elasticity of the arteries. It maintains the collagen in your skin. All these changes we start having, and mostly we see it in the face, but in the rest of the body as well. So that the collagen becomes thinner, and that's why we start having all these wrinkles and stuff. And it's also very important for brain function. like I said, a lot of women experiences changes in memory, in their executive function, in connected to estrogen deficiency as a result of menopause. And it's very important in just our regular sexual behavior, you know, in feeling desire, actually feeling like you want to have sex, and able to have sex, because it's also responsible for maintaining this elasticity and of our, you know, vaginal area as well. And like we all know, it's very important for bone density. Estrogen maintains our bone, you know, strong, and yeah.
So clearly we need estrogen, right? I mean, you just listed all these things, some of the 400 functions that it does. None of these I would like to give up personally. And so that's why where bioidentical hormones come into play, because
plus our body throughout all our you know, like throughout all our menstrual life, kind of like it's used to have those hormones, like stimulating the right receptors and everything, and then you know, and then abruptly, kind of a lot of times we start having such a huge decrease in that. And like you mentioned before, because before it didn't really matter, like, I mean, we would not have such a long extent of our lifespan. So before it was okay, by 50 you have decrease in estrogen, but you know, the nature doesn't really need you anymore, and you're
not having babies anymore. So
exactly. But now we're expecting to live for another 40 years at least after you're 50. And what do you do this 40 years? And so you need to support your body with a normal hormonal presence to maintain all these systems of the body to kind of work well. So, and then there's different types of estrogen. There is the main one that everybody knows, and the strongest one is estradiol, or E2. It's the most dominant estrogen during our reproductive years. It's the one that are missing when we start having the hot flashes and night sweats. That's the one that we need for our cardiovascular health, for brain function, the bone density. So that's the one that we need. And when we supplement it, we supplement this estrogen in the in our supplemental program. So estradiol is important. Another estrogen that is important, and it's estriol. So estriol is the most protective estrogen, and it's actually prevalent as well during our reproductive years, but once we go into menopause, it decreases. So it decreases its protective effect. So a lot of times when I prescribe women the estrogen topical, we include this protective estrogen as well. So it's protect against breast cancer. And naturally you would decrease that protective effect if you are lacking this estrogen. Important thing, that if you use commercially available creams, estriol, so estriol available as a commercial cream, but unfortunately those preparation never contain this protective estriol, E3 type of estrogen. So that's why when I don't really prescribe commercial creams, I use compounding pharmacies, because I'm able to add this protective estrogen estriol to the topical cream that I prescribe.
And we here at Levita, we're a hybrid pharmacy, so we carry the commercially available medications as well. So we have the patches and all of that, but 99% of the time what's prescribed now is the biester. We'll talk about that later, but it's a combination of the estradiol, that workhorse estrogen that's helping with the hot flashes and brain fog, and then this estriol, which is protective, and studies have shown it binds to the receptors in the breast tissue where the more cell proliferative estradiol would normally bind, and protects that way. So for my money, I want that. Estriol is a very weak estrogen. It doesn't do a whole lot beyond helping with skin. It helps a lot with skin, and it protects from breast cancer. But so for my money, I want that on board also.
Absolutely. Yeah, because the just aging is increase your chances of breast cancer. So and any other cancer. So why don't to add this one to protect yourself, because that's a concern for women to decrease their chances of breast cancer. So the next one is progesterone. So progesterone is another very important sex hormones that also decrease during menopause. Progesterone is hormone. It's also very important on balancing your mood, stress, irritability. It increases your good cholesterol. It's helps with sleep. That's where I see a lot of the benefit of progesterone. It works like magic in most of the people who are prescribed it to. If the women start having problems with sleep on the onset of perimenopause or menopause, oral progesterone works very well to kind of restore their sleep, to increase their REM sleep, basically where they feel like they're getting the very restful sleep. They wake up in the morning and they don't feel groggy, they feel great. So progesterone is very important to supplement. And it's also important to supplement if you supplement estrogen, because it protects your uterus from developing any cancers there. And but interesting thing that the latest research shows that even if you don't have uterus, you still need to supplement progesterone when you're supplementing estrogen, because it has so many other functions. So it's not just protecting uterus. So yeah, I definitely always include progesterone in my prescription, the bioidentical hormones. So very important hormone as well. Going back.
Is there any questions? Does anybody have any questions for the good doc? Don't be shy. We're here to help.
Okay.
Okay.
We can answer questions at any point. So another important hormone is testosterone. Testosterone is important in females as well as in males. In females, a lot of time I test testosterone, and if I see it's low and there's the corresponding symptoms, I usually are like lack of self-confidence, lack of motivation, like where the women feel like she doesn't have this will to like to do something, or to motivate herself, like even to exercise and stuff. And a lot of times it's energy also, and it's like libido issues. So testosterone can be a really great help in addressing those issues. So I use testosterone as needed, as these issues arise. And again, it's a huge difference in the symptoms that people feel after supplementing, if they've been missing it. And not everybody need testosterone. In my experience, a lot of women even after menopause, they have a good sources of still produce testosterone. So, but if you lacking testosterone, that could make a huge difference in how you feel.
I see doctors too using it not solely, but in combination with if patients want to lose weight for metabolism, because you're building muscle. Muscle helps burn fat. Yes. If you're not able to build muscle, you're behind the 8 ball already on the weight game.
Exactly. And for the women who just like keep exercising but don't feel like they are building muscle, right. It's important. Exactly.
Sure.
So okay. So another hormone that is not really connected to the menopause, but could be another piece of the puzzle, it's a thyroid hormone. So I check thyroid in all my patients, because thyroid is, it just could be low, and it could change so many how you feel, basically. It's very important in metabolism, and in just in maintaining the good cholesterol, and weight gain. It's huge in the weight gain, and hair loss. Like basically there are some symptoms that just like screams testosterone. If you fatigue all the time,
Mhm.
you have a really dry skin and like losing hair, if you're gaining weight and you hasn't changed anything that you eat, all of those symptoms could be the sign that you are missing the thyroid. And the thyroid is also available as a supplementation. And it's especially important in women because the women, for some reason, are prone more to having thyroid issues. And if we don't address thyroid, a lot of times we're not going to be able to address other sex hormones like estrogen, progesterone, and testosterone. It's not just going to work if we don't address the thyroid. And the thyroid is also available in compounding, like a preparation kind of that can be precisely dosed to the needs of the person. So,
And Doc, don't you think thyroid's really underdiagnosed? And not in your world, but it may be in allopathic medicine. I see so many patients come in and they have all the symptoms of low thyroid, hypothyroidism, and the doctor maybe only ran the TSH, thyroid stimulating hormone, and based on that alone said, oh, your thyroid's fine. A doctor like you goes more to root cause and digs deep. You're running a lot more thyroid markers,
yes,
right?
I definitely run like a full thyroid panel, especially if somebody coming to me with these concerning symptoms that I mentioned. I definitely checking their TSH, their T3 and T4 hormones, and sometimes even the thyroid antibodies.
Awesome.
And plus a lot of times, even if the test come back pretty much normal, they could be on a lower normal level, and plus the person has all of those symptoms. So sometimes it's just you need to support that hormone as well. So yeah, we definitely do. I do like a deeper investigation in the thyroid help and try to, if the person have a deficiency, we try to unravel it and help.
Yeah. Yeah.
Yeah, because it could be huge. Like, I mean, the thyroid is in the center of your metabolism. And if you cannot metabolize that what you eat, correctly, like nothing else gonna work well in your body. So it's a crucial to make sure we if you have a deficiency to take care of that. Yep. Okay. Another part that I haven't, I haven't been used too much, but now I'm doing more and more of this. Actually, prescribing estrogen as in the preparation in the cream, combined with other nutrients, and it's working well for women because, like we already mentioned, the skin elasticity, the collagen is very dependent of how much of the estrogen, progesterone, testosterone you have. So especially estrogen in this respect. And so it's possible to make a cream that's going to have some estrogen in that and apply it topically into your face and decrease this fine line appearance and like this increase, like the pore size, like all of these concerns that we start having with age just by applying this cream daily on your face. So, Chris, do you want to talk more about it?
Yeah, this is some of the fun stuff we get to do, because I think we get women feeling really well. They get hormonally balanced and then they want to look as good as they feel. And our estrogen receptors all over your skin as well. And you talked about the skin integrity and collagen and elastin, and it does help with all that. When we started adding the estrogen to skincare, you could really see a difference. It's a game changer. I'm not going to market it as a facelift in a jar or anything like that, because I don't like to be marketed that way. But it is really good skincare, and it sort of came about because I love skincare, and I'd go and I'd spend a fortune at Nordstrom's on really glorified 1% vitamin C or something that was probably unstable anyway and not even 1% potent. So I got into it that way. I wanted to give you as much as we could in one cream and have it be clinically effective. And it is nutrition for your skin. Everything in it's really clean and green, but clinically effective. And that was the caveat. If I was going to do skincare, I wanted it to do something, because we are prescription only. We can say that it actually changes your skin for the better. It decreases, there's studies out there showing estriol added to the skincare decreases wrinkle depth, increases collagen, increases elastin. So yeah, we do a lot of the skincare, and I think women really love it, because it's clinically effective. We're not trying to oversell anything, but it's really pretty much the best you can get. You get even, I know what's available commercially too. There's just not a lot out there.
Yeah, and so that's kind of how I got into that too, because I want my patients not only feel good, but like look good. And it's, it's an issue too, because people come and tell me like they start having like a sagging skin and they notice more wrinkles and the skin is drier and stuff. And so that's the way of helping with that as well. So another thing that I think I mentioned earlier, that estrogen can be used in the preparation and used intravaginally as well. And that could really be a game changer for increasing like moisture and just like increasing the thickness of the vaginal wall, which can become very thin if you has been missing estrogen for a while. And so that works very well for the women who start having pain during intercourse, who doesn't have enough lubrication. So that's another way I've been using compounded pharmacy preparation of estrogen as well. So it works very well.
And such a common thing to happen. I think women get embarrassed over that, but it's so common. It happens to so many women, the vaginal dryness, painful intercourse, and it's really fairly easy to fix.
Exactly.
So,
that's
yeah,
the amazing thing about it.
That's happening. Yeah.
It is easy to fix. Actually, this is like kind of, I have 100% pretty much record of that, because it's just, you use it. And the beauty about it, you have to use it for a couple of weeks daily, and then you just use maintenance dose, like maybe once a week. Some people forget about it, use it like once every month, just maintaining this now. Yeah, so it's a great therapy. I love it, and I'm happy when I'm able to help women with like feeling good in that area. So, and Chris, tell about what's the difference between compounding preparations?
Right. So compounding pharmacy, for those of you who don't know, is we take things based on prescription only from a doctor, using raw ingredients, and create things. So we create things that aren't commercially available. We're accredited for both sterile and non-sterile compounding, which means we're held to a higher standard than a non-accredited pharmacy. Less than, I think, 1% of pharmacies have that level of accreditation. So we're very proud of that. We just went through reaccreditation. It's a lot of work, but for me, I feel like when we make a prescription of progesterone 100 milligrams, Dr. Tarabrina knows that's what the patient got and can adjust doses based on that. If like, oh, the dose is so low or the dose is high, there's consistency. So we're inspected by the boards of pharmacy, the FDA. Our accrediting body can walk in at any time. All our raw ingredients are sourced from FDA approved chemical houses. So there's just a lot more going on. The equipment we use, the training we do, it's pretty extensive.
Yeah. And I think for me, I use compounding pharmacies just to have availability of this preparation, to have thyroid available at different strength, combination of T3 and T4 in different strength, so I can precisely dose it to the particular patient. Opportunity to make the estrogen vaginally available or in a face cream, all kinds of ways of preparing it and delivering it, and then more precise dosing. So it does work very well in my patients. So that's why I'm using it. And we have quiz now.
Yeah, a little quiz.
So Chris, do you want to take
go ahead. So go forward. So I'm gonna move my thing here. So this is a little quiz, guys. You can chime in through the chat function below. your midsection is getting bigger and gaining weight despite working out. What's to blame? Is it 1, high progesterone, 2, low estrogen, 3, estrogen dominance, or 4, none of the above? And there are no, I mean, just chime in and we will give you the answer. We're not here to make fun of anyone. You're not supposed to know this stuff yet. Go ahead. Okay, I got a 3, estrogen dominance. I got a low progesterone. Okay, go ahead.
That's
3. So from Mia, am I saying your name right? Estrogen dominance. Good answer.
Thank you.
the next question.
So you're happy 1 minute, irritable and annoyed the next. This is caused by, you can't say your husband. 1, low progesterone, 2, low estrogen, 3, high testosterone, or 4, none of that. Go ahead and chime in. I got a 3, none of the above, 2, and 3. All right, Doc, what's the answer to that one?
The answer is low
Yeah,
progesterone.
because we call progesterone the happy hormone. It really does. We call it nature's Xanax. It binds to receptors in the brain, GABA receptors in the brain, and just causes this natural relaxation. So it helps you with mood and sleep both, as you mentioned earlier, the sleep. Yeah.
Yeah, makes you feel calm and yeah. Okay.
And last one, you can't sleep or stay asleep. What's to blame? I just told you this, so who listened? 1, low progesterone, 2, high testosterone, 3, low estrogen, or both 1 and 2. Got a 1. Okay, go ahead. Hopefully they all know this.
Yeah, it's definitely low progesterone because yeah, that's what we supplement in and it helps like tremendously. Yeah, especially like oral progesterone. So could be okay. And
So yes, that's our talk today, folks. Thank you so much for being here. We're going to have some giveaways, so stay on. Does anybody else have any final questions we had a question, so let me open this up. I'll read it to you, Doc. It says, I think she's referring to thyroid. I had that happen to me. My thyroid was off, but came up normal in many tests, but I had my doctors thought my symptoms were perimenopause. I tried bioidenticals only to have my thyroid get really horrible, bad symptoms, so sick. I have since gone on levothyroxine, but now I am still having perimenopause issues, dry flaky skin, dry breaking hair. I've started on spironolactone, saw it on the doctors on TV to help some perimenopausal symptoms. Went and arranged for my doctor to prescribe it, and I'm still researching this menopause stuff. LOL. I ain't getting any younger. Well, none of us are.
So that's what I mentioned before. Like, I mean, all of those hormones are connected. We kind of need to address and a lot of times supplement like multiple hormones in order to bring you to like an optimal health and optimal wellness. So absolutely. But like I would retest all this sex hormones and your thyroid hormones and making sure you are getting enough of the supplementations, and then also review all your symptoms and stuff and kind of try to decipher what your body needs, how it needs to be supplemented.
Okay, any other questions, guys? If not, I've got Orly. Orly, are you on? Orly Perez, she's one of our sponsors. Bella Serena, do you want to come on and say a few words, Orly? Helena, can you unmute her maybe?
Yes.
Oh, she's unmuted. Okay.
Oh yeah, I just got unmuted now. Yeah. Hello? Oh, maybe it's the video.
Hi, Orly. Is that you?
Hi. Can
Hi,
you see me now? Oh, I guess the video won't show. I think that's okay. Hi.
Hi, Orly. Thanks for your sponsorship today. We got a good message out to the people, I think.
Thank you. I appreciate, first, I would really like to thank Levita Compound. I've been an active user of the thyroid armor for the past, gosh, I want to say at least 8 years now. And that's been ever since I've reached pre-menopause in my early 40s. And that's really helped my hormones, my metabolism, my skin. So thank you.
That's awesome.
And yeah, it's been a huge part of my my well-being. So thank you for that. And yeah, so Bella Serena, we're celebrating our 10-year anniversary here. Big milestone. We're a full day spa in Solana Beach. We from hair to energy healing to hydrofacials, customizing in all skin types, mainly hyperpigmentation and hormonal as well. And yeah, we're just we've reopened, so it's been quite the ride here, but it's been good.
Fun year, huh?
Yeah, it's been a fun ride. And it's been really good. It's we have a really loyal clientele, and slowly everybody's come back, and my staff is all back, so it's been really nice.
Awesome.
Yes.
Cool.
So
Well,
thank you. Yeah, thanks for having us. The hydrofacial is definitely something that we brought in just right before COVID, and it's a really, really lovely treatment. It hydrates you from a deeper, from your dermal level, deeper into your epidermal level of your skin. So it's definitely worth experiencing. And we are running a special, a $199 special through Mother's Day. So thank you.
Awesome. All right. Well, thanks. That's great. Good to hear from you, Orly. And Dr. Tarabrina, how does one make an appointment with you?
So there is a number right there on the screen. It's 858-925-8233. Just call in. There is somebody going to be in the office, and they call you back, and you can talk to them about if we take your insurance or not. And yeah, if we do, and even if we don't, you can pay out of pocket and then make an appointment with me in Del Mar, in beautiful Del Mar. You can come in person. And right now we do a lot of Zoom appointments as well, because some people still don't feel safe coming in in person. Yeah.
And I think you guys take it. I mean, the fact that Dr. Tarabrina builds insurance is huge, because honestly, 99% of people that do healthy aging and wellness do not take insurance. So that's definitely a distinguishing factor for you guys. And that's awesome.
Yeah, and I'm happy to do that, because I wanted to make as affordable as possible for people.
Right, for the masses. That's why we take insurance as well.
Mm-hmm.
Levita. All right, we're going to give away some stuff, unless anybody has any more questions. So why don't we, Helena, why don't we start with the Levita face mask?
All right, I'm going to spin the wheel. You can hear me, right?
Yep, we can hear you. Vanna White.
It's Mia.
Mia, excellent news. Mia was one of the good chat responders. We will get this sent to you, Mia.
So Mia would be the face mask. Okay, so
face mask.
And the next one would be
is the Levita visor. Get out there and
spinning the wheel. Congratulations, it's Mikha.
Excellent news. What was that name again?
Mikha.
Mikha, okay.
Mikha.
Excellent. All right, we're going, Micah, if I'm saying that right, please.
It's me.
You're gonna get the Levita hat. Yeah. Next are 2 half-hour sessions with consultation sessions with Dr. Tarabrina. So let's spin for the first one, Helena.
Okay. Spinning now. It's Josette.
Josette, excellent. Helena will get you any information you need for that. And we have one more half-hour session to give away a lucky winner.
Okay, spinning the wheel. It's Susie.
Susie. Excellent, Susie. Excellent, Susie. You won the second half-hour session. As you can tell, Dr. Tarabrina knows her stuff. It'll be time well spent. And I just want to thank you, Doctor. Wonderful job. And thank you for offering your knowledge to everyone today. We really appreciate it. This information needs to get out to the world. All women need to know this.
Exactly. We
Yeah.
all need that at some point. Yeah.
Yeah. So thanks for everyone for being here. If any of you have questions, you want to reach out to me, you can reach me at Levita Compounding Pharmacy. I'm happy to help you on your quest for wellness, and we're all in this together. So thanks so much, Doc. Everybody have a wonderful day, and we'll see you at the next one.
Thank you.
Thanks. Bye-bye.